Hi, friends. This episode of the Cozy Lung Lounge is brought to you by Hootenanny Joy, where your health and wellness take center stage. At Hootenanny Joy, we know how overwhelming it can be to stay on top of your health, especially when life gets busy or chronic illness adds challenges. That's why we've created self-study programs designed to meet you right where you are. These programs are simple, flexible, and packed with tools to help you thrive. And they come with something extra, access to a live health coach. That's me, to guide you every step of the way. Whether it's improving your sleep, learning to nourish your body, or managing stress, our programs combine proven science with practical, real-life strategies. You can work at your own pace, get the answers you need during coaching sessions, and feel confident you're making progress. Ready to take that first step? Visit hootenannyjoy.com to explore the programs and choose the one that fits your journey best. Hootenanny Joy, because your health deserves a little joy.
Hi, and welcome back to the Cozy Lung Lounge. My name is Kelly Lewis.
I'm Amy Sheldon.
And I'm Gina Hoots.
So I'm really excited about our conversation for today. I will definitely be taking a little bit of a back seat today as we talk about medication management. So I'll let you guys go ahead and get started. First of all, let's go ahead and talk about consistency. Did one of you guys want to speak about that today?
I'll go ahead. So we're talking about medications and medication management and consistency of taking your medications on time. Before we talk about that, I want to talk about exactly what qualifies as a medication. I spent a number of years working in the emergency room, and when I would ask people about their medication, they pulled out all their pills or a list of pills. Either one is good. If you bring all of your medications in a bag, that's fine. If you have them all listed out, that's fine. But this person who came in would be a known COPD patient or a known asthma patient. And I would say, what about your inhalers? Oh, yeah, those. And then they would kind of not remember their inhalers because they didn't write it down, because they didn't think of it as a medication because it wasn't a pill. And same thing with their liquid medications. If they had nebulizer, liquid albuterol, for example, or liquid duoneb, that didn't really count as a medication because it wasn't a pill, but it is a medication. And just want to remind everybody, don't forget to add that to your medication list. And if you're bringing all your medications in a bag to a doctor appointment, don't forget to throw in everything that you inhale as well. And so having said that, I think a medication schedule is important. In other words, if you're prescribed to take your inhaler or your nebulizer every 4 hours or every 6 hours, a lot of patients will say, well, I didn't take it. I know I'm supposed to take my inhaler 4 times a day, but then I forget. And then my doctor told me not to double up. So I end up only really taking it twice a day. And that doesn't really do it for most people as a baseline routine. Gina, what do you think about that when that happens?
Yeah, I think it depends on what kind of medicines you're taking and what the plan of care is. Real quick, like you talked about, what are your medications? I want everybody to remember that herbs, over-the-counter anything, everything from the nutrition shop, those also count as medicines because they can interact with things as well. They can interact with your sleep. Some of them are blood thinners. Some of them are antidepressants. So that's really important.
Speaking of herbs and all this kind of stuff, it's really popular now. People are buying these things like mushroom coffees. I know that I put a superfood mix in my morning smoothie, and it's got things in them called adaptogens. So if you're taking any kind of a supplement that's got adaptogens in them, those might interfere with your medication as well. And that's anything that you're adding to your smoothie, an extra boost of, I don't know, maybe it's even in your protein powder if you're making that in the mornings, and mushroom coffee, anything like that. Those are all adaptogens, and those can interfere with medication.
There are some medications that have caffeine in them, for example, a painkiller for your headache also could have caffeine in it. Too much caffeine can cause heart palpitations. And so definitely be aware of all of the medications that you're taking. When we're talking about consistency and inhaled medications particularly, you need to know what kind of medicine you're taking. Is it a controller medicine? Is it a reliever medicine? Is it something you grab for sudden symptoms? Or do we need to be taking it regularly for the effects to happen? So all of your albuterols, there's a million names for them. Any albuterol is a short-acting bronchodilator. It works quickly in the first 5 to 15 minutes. Do a couple of puffs, and it works quickly to relax the muscles in the airway. Many other medicines are controller medicines. You see a lot of them on TV now. You'll see Trelegy and Advair and Brio and Symbicort. I want to try to capture all the different brands that are out there. None of them are any better than others. They all work for your body differently. But you want to take those regularly. You can't just pick up a controller medicine and take it when you're feeling poorly. So if you're prescribed Trelegy, for example, that one has 3 ingredients in it. You take it once a day. Big deep breath and hold it for 10 seconds. That's all you have to do, just the one time once a day. It should hold you for 24 hours. If you're taking that erratically, it's not going to give the same benefit. So take it about the same time every day. So like at breakfast time. I don't want you to think you have to take it at 7 o'clock every single day. 7 o'clock, 8 o'clock, even 10 o'clock. Not going to mess up the schedule if it's once or twice a day. If it's 4 times a day, though, you want to be a little bit more cognizant of what time you're taking it. And so if it's every 4 hours, you may not want to take it every 3 hours or push it to 2 hours. That might be too much all at once. So really you need to know how the medicine works, why you're using it, and how fast it works.
And I think there have been some recent changes in the asthma guidelines as well. They're now using relievers as controllers and vice versa. So just if you're not sure which one is your controller, which one is your reliever, or if you have one medication that's supposed to cover everything, just ask your doctor. And I used to tell patients, get a big fat Sharpie and write the C on one for your controller or B for baseline, and then relief, big R on the other one for reliever, so that you don't mix them up. Because when you suddenly have an onset of shortness of breath and you're getting kind of panicked, you're not going to really maybe remember which one is which. And it's important that you take the right one to give you a quick relief.
I've got some experience with that new kind of asthma therapy, Kelly. One of my sons, my almost 12-year-old, he's on what they call SMART therapy, single, maintenance, and rescue therapy. So he uses Symbicort for everything. He does 2 puffs in the morning, 2 puffs in the evening, and then he grabs it as his controller medicine all day long. Now, he doesn't need that much of it. If he would need 6 or 8 puffs a day, we'd need to have a conversation with the doctor. But most of the time, he's in good control. The reason that this kind of therapy is important, particularly, y'all know I live here in the cornfields of central Illinois, during harvest time every year, he's feeling really well. He forgets to take his inhaler. Then we have harvest come in. And everybody knows that September is very bad for asthma because of harvest, mold, back to school. And so every September, we tend to use a lot more Symbicort, but it gives him that extra dose of steroids on top of it that may be important for an asthma attack. So if your COPD is more the asthmatic kind, you may need your controller closer. If you have more of an emphysema or bronchitis kind, you may need other kinds of therapies close at your hand.
And Gina, do you have that sheet that shows all of the inhalers? Do you mind holding it up for a second? Because I just want to mention, if your regimen of inhalers or inhaled liquid medication nebulizers isn't working for you, let your doctor know, because there's only about, 50 or 60 different inhaler formulations to choose from. You're not limited to just your doctor's favorite or the one that your insurance pays for. You should find the one that really controls the very, very best it can so that you're minimally using that rescue, minimally, and ideally never if you're well controlled. So if the current thing you're on isn't doing it for you, let your doctor know. There's plenty of other choices out there.
I'm going to try to hold it up and see.
It keeps disappearing.
I've got a blue screen here, so I don't. Oh, there, I can do it with my face. So there's a very good resource and it quickly becomes out of date because new inhalers are on there every time. This one happens to be the most recent that I have.
Just make sure to ask your doctor. The goal is that you never need a reliever. So if you're using your controller faithfully and on time and consistently, and you're still hitting your reliever more than once a day, you need to let your doctor know so he can put you on a better baseline, so that you're not hitting your reliever all day long.
One piece of information that's really important here while we're talking about this. When you look on the graph of medication, I've got a lot of different inhalers there. And Advair is no better than Brio, than Dulera, than Symbicort. Those are 4 medicines that are kind of the same. They have a long-acting beta agonist. I call it LABA. They have a steroid or an ICS. All of those choices have a LABA and an ICS. The big difference is the pharmacy system in the United States. Only one of those has a contract with your prescription provider. I don't know what that is. Your doctor really doesn't know what that is. The only person that knows that information is the pharmacist that you use. Definitely a terrible situation for most of our patients to be in. But if you go to the pharmacy and your inhaler is $500, please ask them if there's another inhaler in a similar class that would only cost you $50 or $100. Your doctor would be happy to get you the medicine that matches your insurance company, as long as it's the best for your lungs.
And conversely, I'll throw in, if your inhalers are only costing you $20 copay a month, but they're not doing anything for you, and you're hesitant because you know the other one is $500, there's a lot of help out there for paying for prescriptions, including inhalers. So sometimes the manufacturers have coupons. You can go on. I've had patients for whom the manufacturer paid for them for a whole year to use their inhalers, and it was a better choice for them. The differences in the inhalers, as Gina said, there's a long-acting agent and a short-acting agent, and sometimes an inhaled steroid, but the formulations may be a little bit different. One may have a little more steroid than another. One may have a cousin of formoterol rather than actual formoterol. So you need to find the one that's right for you. Another good one is GoodRx. That will take the cost down sometimes, but don't skimp on yourselves just because it's the only thing that your insurance will pay for, or it's the only one that the copay you can deal with. There's lots of options for help out there to get you what you need.
Living with a chronic respiratory condition doesn't mean giving up the things you love to do. At Blue Zone Health, we're here to help you breathe easier and rebuild your strength. Our online cardiopulmonary rehab program offers tailored exercises, self-management training, and expert support from certified respiratory therapists. Accessible anytime, it's designed to reduce breathlessness, improve lung function, and empower you, all while connecting you with a supportive community. Visit bluezone.health and take the first step towards stronger lungs and a healthier future. Blue Zone Health. Breathe better, live better.
Absolutely. There's sometimes they'll want you to do step therapy. You know, you failed this one, then they'll try a new one. We'll fail that one. We'll try another one. That's pretty big out there. And the formulation is really important, particularly if your doctor wants you to be on this smart therapy. Only a couple of inhalers qualify for that particular kind of dosing. Other steroids only can be taken once or twice a day. So that's really important for those combinations. You know, Amy, we've been talking a lot about inhalers, breathing treatments, but I know people that I'm spending time with every day have a lot of back pain, knee pain when they're walking, and I want them to do pulmonary rehab, but their backs and their knees hurt. What can they take for those kinds of aches and pains?
So I would say, particularly if you're on a lot of medication, always double check with your physician. And if you're having a lot of specific pain, that's another good thing to bring up to your physician as well. If you're having a lot of knee pain that's undiagnosed, you're having a lot of back pain that's undiagnosed, first step is definitely to talk with your physician about that. Outside of that, there are always different anti-inflammatory medications. A lot of times with injuries, they can get inflamed, and that inflammation and irritation with that fluid can really intensify the issue sometimes. So different anti-inflammatory medications, a lot of us know ibuprofen can be used, but we don't want to use it too often, too frequently, because it can be damaging for your liver. So if you're having kind of long-lasting pain and issues that have not been managed or talked to with your physician, that's definitely a good place to start. But if you need short-term relief and it's something that has been okayed by your doctor, taking ibuprofen, there's tons of different pain relievers, but some of them are anti-inflammatory, and those are the ones that will really help if you've noticed inflammation that tends to irritate the issue.
You know, both of you brought up a really good point. I've had a lot of patients tell me, oh, I can't do pulmonary rehab because my knee hurts. I can't do pulmonary rehab because my hip hurts. You know, I can't do exercise because this or that or the other thing hurts. And welcome to getting old. That just happens. But there are so many alternatives to exercise. For example, I had a couple of patients that didn't want to get on the bike because they were bone on their knee and their hip hurt. But there's a little machine called a new step, where instead of cycling around, you're just pushing. It's still really good exercise, but it's very gentle on the knees and gentle on the hips. And there's so many alternatives. And I'm sure Amy could think up about probably 200 alternative exercises that you could do. So don't be afraid of pulmonary rehab and exercising because something hurts. We can get that looked at and optimize your exercise routine and work around that.
Absolutely. And one thing I just thought about as well, thinking of kind of an alternative to taking a medication orally, is you can also think about something like Voltaren gel or Aspercreme. There are some different topical pain reliefs that are topical lidocaines that also may be really helpful. And again, I always recommend you check things off with your physician, but that's another really great one. If you don't want something that's going all over your body, you can use a little bit of that topical ointment.
Kelly, didn't you do a session a few weeks ago with Right to Breathe on asthma and COPD action planning?
I did.
Now that we know what kind of medicines we have, how do we put that into an action plan?
That particular episode, we talked about action plans, and I have 3 different ones. You can download them from American Lung Association, I think American Allergy Foundation, American Asthma and Allergy Foundation of America also has ones that you can download. And there aren't any for pulmonary fibrosis or interstitial lung disease, so I made my own. But no matter which one you choose, and if you're not sure if you have asthmatic bronchitis or, you know, the asthma-ish side of COPD, it doesn't matter. What the action plan does is you sit down with your doctor and you figure out what your baseline is. And the doctor says, okay, as a controller, I want you to take this, this, and this so many times a day. And then the doctor will say, all right, if that doesn't do it for you and you're still feeling short of breath, then you can add this as a reliever. And he may add some other things in there depending on you, your body, your breathing habits, etc. But it is something that you sit down and fill out with your doctor. And essentially, he or she, the doctor, is saying, this is what I want you to do. And in case this doesn't work, then I want you to go and do this next step. And if that doesn't work, then I want you to do the next step. And so it's a definite outline of what to do, as opposed to just taking your inhalers willy-nilly. And then when you get a little short of breath, you head to the emergency room right away. It's a definite list of things that your doctor wants you to do. So absolutely download one. Next time you go to the doctor, say, hey, you and I together, we're going to fill this out. What should I do if this happens? What should I do if that happens? Now, optimizing your medications first is step 1.
Now, one thing I have, we talked about children the last couple of weeks ago, and it's really helpful to talk about that again here because medication should be put up away from children, out of their hands. You know, they may take pills like candy, that sort of thing. That's very dangerous. But even more than dangerous, it's really irritating to have a little child push your inhaler, push, and use up all your puffs. Now, it's really fun for them to push that down over and over, but you may not have a refill available for the rest of the month. So putting the medications away is super important for that one particular reason.
Absolutely. And along those same lines of being accidentally out, During the holidays, and especially for some of us where we live, where the weather gets a little bit funny, do you have enough of your medication, your baseline and your controllers and relievers to get you through, say, a 7-day snowstorm, or to get you through a period where you may not be able to drive on the roads would be closed, something urgent or emergent, such as what happened in North Carolina, flash flooding, and all of a sudden there were no roads. There's big storms happening in the Northeast right now where nobody should be out on the road, actually. But do you have enough medication on hand to get you through something like that? So just double check. And the other thing is are you forgetting or losing your inhalers all the time? Especially, as Gina mentioned, when you have kids come over and you're putting your inhalers up out of the way, when you're used to having them laying all around the house right in front of you. Okay, where is it? Where is it? But are you the kind of person that you jump in the car to go do something and you're going, oh, forgot my rescue inhaler. Oh, well, that's okay. And then you get to where you're going and you end up in trouble. So could you get an extra couple of prescriptions? Keep one in your car, as well as one in your purse, as well as one at work if you're still working. Can you keep one also in the bathroom or next to your bed, wherever you need it, so that you're not running all around looking for an inhaler, or you don't have it with you when you need it the most?
This brings up a really good place to talk about inhaler maintenance. So if you have several of those inhalers around, you may want to periodically check them. So look at the little exit where the mist comes out, the little valve stem in the inhaler. It can get built up powder in there. And so you'd want to rinse that out with some warm water until the pinhole opening is clear. You should be able to not see a lot of debris in there. If they're gone a long time without being used, you want to shake it up real good. You may want to what they call prime it. Push it down one time. I had a patient the other day tell me he was recommended to prime it 3 times, but he thought that used up a lot of medicine every single time. And yes, I don't want you to ruin your inhaler by priming it all the time, but you will want to make sure that at least that first puff comes out well after it's not been used for a while. And you must use, in my world, a spacer or a valve holding chamber is super important. Many people just take the inhaler in their mouth. If you have access to a valve holding chamber, it will make a lot of difference with where that medication gets into your lungs. It's got to get down deep into your lungs to do some good. So that's really important.
And if you need a pocket-sized spacer, they do make those. They make one, the name escapes me right this minute, but it folds flat. It's like a little flat piece of paper. So gentlemen, you can put that in your back pocket. Ladies, you can put that in your purse. But I also want to talk about the importance of putting a cap on your inhaler when you're not using it. I had a lady, true story, just would use her rescue inhaler, throw it in her purse. Well, I don't know where she was, but she took her earrings off and threw them in her purse. I think she went to the gym. And the next time she reached for her inhaler, she picked it up out of her purse. She wasn't a shaker. She wasn't good at shaking it. So she picked it up out of her purse, popped it in her mouth, and got an earring stuck in her lung. Had to go to the emergency room and have it removed with a bronchoscopy. No fun. So please, please, please put the cap back on when you're done.
It's really not, so you can't just say it's just an inhaler, because it's really a very important medication for the management of our patients. Every inhaler is just so tailored specifically to each kind of lung problem that you might have, that it's really important to get the right formulation down.
Make sure that you know your medications by name. Not, I have an orange inhaler and I have a blue one. Well, it's kind of teal. If you have the medication list, please write down exactly what it is and keep it updated if your doctor changes your medications quite a bit. And if you're not sure that you can keep a list updated, you can use your phone. Most all smartphones have a notes feature on it now, and you can update it there. It's also a good idea too, because I've had patients that we say, well, what's your medications? Did you bring your medications in? And they shake their head no, because they're so short of breath. They can't talk. They can't tell us anything. Do you have a list? No. Do you have it on your phone? Pictures of it somewhere? They can't talk. They're trying to breathe. So we don't know what that person is on. So please keep an updated list with you.
Absolutely. And I think that that speaks so much to safety. Thinking about, if you're out in public and you've forgotten your medication and something happens, it's important to have that list with you. I know that there's a way to kind of have a medical list that will pop up even if your phone is locked. There is a way to do that, especially on the iPhones, I know, so that if an emergency happens, your EMS or whoever is there to help you can actually look at that list of medications even when your phone's locked and they don't have you to help get it open. So that's a really important thing to look into. I know some people wear wristbands with their medication lists, and it may not be the most exciting thing, but if that may be something that you're really worried about when you're out in public, is what if I do forget something? What if I have an emergency? Those are two really good tools to have just in case, so that the people around you who are trying to help you know exactly what you're on so they can help you as quickly as possible.
Amy, you mentioned the in case of emergency feature on your phone. And again, most EMS can unlock a phone and get in case of emergency, and people put a contact person there. But some phones have room for notes, and that would be another place where you could list, I have COPD and this is what I take, or I have asthma and this is what I take. I have high blood pressure and these are my medications. You could put them in that phone number spot, if you will.
This has been a wonderful talk about medication management. There's probably so many other questions that our listeners are having right now. What about this? What about that? We'd love to have some of you come into the Cozy Lung Lounge sometime. I keep wanting to call it the Crazy Lung Lounge, but the Cozy Lung Lounge, we'd love to have some patient questions come in so that we could really make an impact in your life.
Absolutely. Always reach out. We have our comment section so that you can reach out and let us know if there's any specific medication questions you do have. We would always love to cover that. Of course, maybe not me, but Kelly and Gina will be able to tell you a lot more about all those medications and hopefully answer all of your questions.
Well, Amy, I have a question for you, something we didn't talk about. What about using extra medication or any kind of medication before exercise?
That's a really good point. So the biggest thing that I think about in terms of medication when you're exercising is bronchodilators. So we talked a little bit about your control medications, which we also call long-lasting medications or long-acting. So those different bronchodilators that are your long-acting ones, generally you should try to use it about 30 minutes or more before you exercise. They do tend to last for about 12 hours. So that's why it's a really good idea to have it at least 30 minutes before, so it can slowly start to kick in so that you're able to breathe as best as you can while you're exercising. And then the other thing to think about is, depending on what's going on, maybe you've been sick recently or you've been struggling with a little bit more shortness of breath. If you're trying to stay on your exercise plan, haven't had time to get to the doctor, or you're just kind of getting over something, you can also use your short-acting bronchodilators. I would say about 10 minutes before you exercise, because those will last for about 4 hours and will really help open you up a little bit more if that's something that you need before you exercise. So when we talked about consistency, it's going to be important to also make sure your exercise is consistent, because you want your medication to be consistent. So if you want to come up with a schedule for the best times to exercise, that will also really pair well with that medication usage.
Yes, because you don't want to start your exercise and then 5 minutes in have to stop, catch your breath, take your inhaler, wait those 10 minutes, and then go back. You've wasted all your pulmonary rehab time just trying to get a breath in. So planning ahead is always a good idea.
Well, speaking of planning ahead, how about next week we talk about oxygen and other medical devices that aren't medication related?
That could be hours long, but we'll do our best not to do that to you.
All right. Thank you, everyone.
Thank you.
Thank you.
Hi, I'm Kelly, a registered respiratory therapist with Blue Zone Health. Do you feel breathless much of the time? Are you unsure of how to manage your breathlessness? Is it keeping you from doing all the things that you would like to do? I'm here to help you learn to work with your healthcare team to come up with a plan that will work for you. There are lots of tools, tips, and tricks and breathing exercises that you can do now that will help you breathe easier and more effectively. I look forward to joining you on this journey and empowering you to breathe better.